Mountain Comp's been in business since 1971. We currently have about 370 employees, 200,000 encounters a year, right at 40,000 patients. We have 9 clinics scattered throughout southeastern Kentucky. We also have 12 school-based clinics in our local school systems here in Letcher County. We go 2 hours drive from here to the west, 2 hours drive here to the southwest, so we cover a large area.
We have many barriers to health care here in this community and the surrounding communities as well. Transportation is a big issue. It's a big barrier.
It's really difficult for patients and families to get to the clinic to get care. So we put clinics out to where they're at. We have a lot of individuals that have a hard time affording to come to the clinic, affording to be able to bring their kids in for vaccinations. If they miss work, they lose their job, and jobs are hard to come by in an area where the unemployment rate is up at 20% at times. Wherever you're at in our clinic system, what do we offer at one? We make it accessible to our patients at the other clinics too.
We do labs, preventative exams, family health care. The bigger clinics, Whitesburg and Harlan, they have optometry, they have dental, x-ray, cardiac, pediatrics. It's like a one-stop visit. People here in this community, they are really excited that we're here because we do offer so many health services and we accept all insurances.
We strive to make sure that everyone has insurance coverage. A lot of times they'll come in and think they don't qualify, but we have representatives that sit down, work with them. We have workers that really work in outreach and go out into communities to make sure that our kids are provided adequate coverage. By having Medicaid, our kids have access to care, and it's so important to have good children's health because without that we can't have healthy adults.
Hey Addie, how are you this morning? I'm gonna listen to your breath sounds, okay? Okay. Big breath in and out. Having a school-based clinic here in Letcher County is very critical. It's very important because some of the kids, their parents work and they may not have the transportation. It may be the only chance that some of the children gets the attention that they need.
We love having our school-based clinic. We've just really taken to the idea. Of course, our school is isolated on this side of the mountain.
Just making a visit to a town to actually see a doctor, is a whole day event.
If this school-based clinic wasn't here, kids would be lacking health care.
We find that a lot of our students wouldn't even go for treatment.
With MCHC actually bringing the nurse practitioner into the schools, then that alleviates a lot of the problems that the parents might have with trying to get transportation to the doctor's office so that their kids could be treated when something is a small illness rather than waiting until it's something bigger.
So having that here has really improved our students' health overall. Our attendance rates have improved tremendously since the beginning of the school-based clinic.
They can come to school and be present at school and miss 5 minutes of class rather than a half a day or a whole day of class.
The most satisfying part of my job is knowing that these children are taken care of.
Being able to have that here in-house for both students and staff is just a huge asset to our small community here.
Here at NACHC, we are the trade association for the 1,400 community health centers that serve the underserved and the uninsured in over 10,000 sites around the country. Over 27 million people are served by community health centers around the country, and 7.5 million of those are children. They're treating young children, getting them enrolled in CHIP. They're treating their parents and grandparents through Medicaid enrollment and services as well.
We like to think at NACHC that a strong health center means a healthy community. So if you have a health center that is being responsive to the needs of their community and providing high quality care, then the health outcomes are better.
55% of community health centers provide services in rural communities now. They are really the core of the community, often being a key employer.
We've gone from probably 50 employees now to almost 400. And most of those people that work here are all local. And being an impact not just from a medical standpoint, but from a community leadership and from a economic development standpoint. We're the third larger employer here in our county.
This is my hometown. This is where I grew up. So I was very excited to get to help my community.
We're not just here to do medicine, we're here afterwards. We don't want the person that does their 40 hours and go home. We want the person at the end of the day that goes out into the community and our community leaders.
Between 1962, when I was born, to 2018, I can't tell you how far we've advanced from where we were. It's just amazing. It's a miracle.
Between 2013 and 2014, Mountain Comp saw a 56% reduction in their uninsured patients.
By giving these people access to health care, we have made them healthier. The investment in Appalachia, the investment in community health centers, the investment in the CHIP program has definitely made a huge difference in East Kentucky, and especially in the Mountain Comp population, and our numbers prove it.
So they are a success story in being able to provide services that individuals would not otherwise have access to in rural communities.
But it takes our workers who have that community drive, that spirit to get out in the community and make our communities and our counties and our towns and East Kentucky a better place to live.
Always got room for another patient. Come on down.